a global virtual platform for caregivers. Welcome back to Techstination. I'm Fred Fishkin. With us from Cleo, CLEO, is Dr. Madhavi Vemireddy. Thank you for taking the time with us.
Hi, Fred. Thank you for having me.
A pleasure. Well, you have a brand new study out, but let's start with a bit of background first. What is Cleo?
So, Cleo supports families across all stages of life, starting from those who are planning parenthood, pregnancy, parenting of all ages, adult care, elder care. It is taking a family-centered care approach to supporting family caregivers and their loved ones. And we do this with a team of experts who are in over 19 countries around the world and have expertise across different stages of life, as well as different care journeys, as well as with our digital platform that is really focused on providing targeted interventions to improve overall family health outcomes.
Sounds like a heck of a mission. So, how
Yes.
how and why did this come about? How did this happen?
Yes. So I joined Cleo 4 years ago. I'm a physician by background. I've been in population health for over 20 years now. But I joined Cleo through the acquisition of a company that I co-founded that was focused on supporting children with special needs, as well as adults with special health care needs. And and that company was called Care Tribe, and that was really based on my personal experience caregiving for my eldest son. I have a son who's 15 now, but I've been an active caregiver for him for the past 15 years. Um, he had, open heart surgery at 9 months. He was diagnosed as being in the autism spectrum, still has significant delays. And it was my background in population health when I realized as I was going through my personal caregiving experience that, we don't have support for family caregivers. Um, and Cleo, Fred, started in 2016. Cleo was founded by an OBGYN, focused on supporting women through their pregnancy journey into parenthood. And when you think about the growing sandwich generation, right, who are in multiple care journeys at the same time, it really made sense for Cleo and Care Tribe to come together to provide that support across all families. And so that's how it came about. It was really both sides were physician led, with the knowing sort of the limitations of our existing care delivery system and knowing how much support families need. The goal was to really help fill that gap.
Really interesting. For those in the audience who may not know what you mean by sandwich generation, describe that for us.
Yes, absolutely. I actually like to refer to it also as the panini because of the squeeze. But essentially, it is they're individuals or families that are taking care of children as well as their adult loved ones. And that adult loved one could, is typically the parents, but it could be you're taking care of your spouse or partner, or you're taking care of a sibling. I'm in that role today over the years, in addition to taking care of my, children. I've had my father-in-law pass away from terminal brain cancer. I've had other family members with a cancer diagnosis, and a dad that just recently fell. And so it just, there are these life journeys that many of us have experienced, or at least know someone that has experienced. But if you're in this sandwich generation, right, you're taking care of many individuals with complex needs. And we know that majority of the time, family caregivers are women, and majority of the time, they're also working full time. So it's that squeeze, that strain, that leads to burnout, that leads to depression, that leads to chronic health conditions like hypertension because family caregivers are not taking care of themselves.
I've heard it said that there are two types of people. There are caregivers and those who will be caregivers.
Exactly. That's exactly right, Fred. That's absolutely right. Yeah.
So there is a new report, the third annual Family Health Index report from Cleo. Tell us about it.
Yeah, so we launched the Family Health Index in January of 2023. So I mentioned, our goal is taking a population health approach to supporting family caregivers. So what does that mean? It means we first need to understand when family caregivers are joining Cleo, where are they? What are their top needs? How has caregiving impacted their own health and well-being? And the challenge we have today in our healthcare system is that family caregivers are largely invisible. And even if you know who is a family caregiver, you don't know what the health and well-being impact of caregiving has had, right? Because caregivers don't show up on a claim line today, right? You only show up on a claim line once you develop a chronic health condition like hypertension or diabetes or depression. And so we're trying to get ahead of that. We're trying to identify early on who are your family caregivers that are at high risk of burnout or might already be at a rising risk of burnout. They're moderate risk, versus those who are doing fine today. But you want to continue tracking them because we know, life happens. Things of, your care journey may evolve for the worse, and that could have a significant impact on your overall health and well-being. So the Family Health Index is looking at 7 dimensions of health. It's a multi-dimensional tool that we built in-house that really allows us to quickly identify where that family caregiver is with respect to their own health journey. So it is looking at things like impact to your physical health, your mental health, your self-care, your confidence in caregiving, your connectedness, right? Is there already evidence that you're socially isolated? It's looking at your caregiving burden. So this is a quick 8-minute assessment that members take. They get a real-time report. For each of those 7 dimensions, they get a red, yellow, green indicator so they know where they're doing well, where they need to monitor, and where they need help today. And our guides, our experts, they get that information in real time so they can proactively reach out. And our digital platform really tailors the experience based on those areas of need. And so what we found in our latest report is the fact that burnout risk is increasing across all stages of life. And we're finding higher burnout risk in those with younger children. Traditionally, what we've been seeing over the last couple of years is high burnout risk for those taking care of an adult loved one or those with teenagers, or those in the sandwich generation. But now we're seeing that higher burnout risk for those that with younger children. And we think, again, it's the juggle, right? They're trying to find childcare. They're trying to, really adapt to their expansion of their family while they're working, and that's creating stressors that's leading to burnout. But the other thing that was a critical finding of our report is the fact that this is disproportionately impacting women because we know today, Clio members, 66% of our members are women. We know from, industry surveys that have been done through AARP and National Alliance of Caregiving that over 60% of caregivers are women. And what we're finding in our data is that if you're in the age group between 40 and 54, which I'm in the top end of that age group, uh, they are at almost half of them are at high risk of burnout, and a little over half of them are scoring positive on a mental health screening tool called the PHQ-4 that's looking for early signs of depression and anxiety. And so we're essentially seeing caregiving as a social determinant of health, and it needs to be a core part of your women's health strategy. But I would say even broader than women's health, it needs to be a core part of your health and well-being strategy for individuals, whether it's employers that are looking at taking care of their employees or health plans that are looking at taking care of their members.
So, how does Cleo assist people? And is this through employers or do individuals come to you?
Yeah, excellent question, Fred. So we work primarily with employers as well as health plans. So employers, they deploy Cleo as part of their health and well-being offering. And we are then a free benefit to their employees. They have unlimited sessions with our guides. Every family that joins Cleo gets assigned a guide, and that guide is with them throughout their journey, right? We're not a call center. They're creating these trusted relationships. They're really understanding what are the needs of that family. They're providing coaching support to improve confidence in that care with the caregiver and what they need to do to support their loved ones. But they're also improving health activation so that that caregiver is also focused on taking care of themselves so that they are not on that path to burnout or on that path to developing chronic health conditions. And, we also provide the concierge support because we know so much of caregiving is really around finding the right resources. Sometimes it's finding childcare. It could be finding an in-home care provider, or looking at senior housing options for your parent, or planning for long-term care. How are they going to age safely in the home, right? And so our team of experts really help that family put together a proactive plan. So you're not just always putting out fires, right? You want to be really proactive and looking at where we have opportunities so that we're driving better outcomes, not only for their loved ones, but for the caregiver themselves. And then same thing with health plans. We work with health plans where they can offer this up to their customer base as well.
So people can check with their health plan to see if it's available if they're not employed or if you're not being offered by their employer.
Yes. And I would say, there's so much stigma, Fred, today with caregiving, and that's a problem because if you don't have the leaders of a company talking about it and sharing maybe their own experiences, right? Just like what we've seen with mental health and with menopause, right? There's a lot of stigma. People are worried that if they raise their hand and say, I'm caregiving, they may not, they may lose opportunities for career progression, right? And so I think this is, like you said, there's only two kinds of people in the world. So, and we know Harvard Business research team, when they looked at caregiving and the way they defined it, they said it's 73% of a workforce. So if 3 in 4 of your employees are in a caregiving role, how do you not talk about it? Right. And so I would encourage individuals who are in a caregiving role and are struggling and are feeling that burnout to talk to their HR leaders. Because the more the HR leaders hear about it as a problem, the more they're going to, prioritize it as a solution or, an area that they need to help solve. And so we're really working on educating the market on that caregiving is not just about talent retention or talent attraction. It is about healthcare, and improving healthcare and really improving it upstream, right? So we don't see the downstream consequences of caregiving.
Really a big, big issue. For more information, where can people go?
So individuals can go to hicleo.com, HICLEO.com. And obviously they can reach me on LinkedIn. But yeah, we're happy to share more information. We're happy to really share more about the Family Health Index report. I encourage individuals to download that report, get more information on just the risks that we're seeing with family caregivers today.
Well, congratulations to you and the team there. Dr. Madhavi Vemireddy, thank you so much for spending time with us.
Thank you, Fred. Appreciate it.
The Haven 10,000 lantern is a smartly designed, beautiful solar light that you will love indoors or out. It is waterproof with up to 1,200 lumens of brightness. That's a lot of light. And the base becomes a flashlight at the push of a button. The power comes from a built-in lithium-ion battery recharged by the sun. The solar panel is built in, or USB-C. The battery can even recharge your phone. Did we mention how durable it is? How it folds down and can run for up to 120 hours on a charge? But the real power of the Haven Lantern comes from the people behind it and their mission to provide this quality lighting to those in the world who need it most, including in disaster emergencies. Your purchase helps to fund those efforts, and if you use the code Techstination20, you'll get it at a 20% discount. That's Techstination20 at havenlantern.com. Create your haven.